Chapter 1: Hand Anatomy. The anatomy of the hand is complex, intricate, and fascinating. Its integrity is absolutely essential for our everyday functional living. The hand is divided into 3 regions. 1. Proximal region of the hand is the carpus, wrist. 2. The middle region, the metacarpus, palm. 3. The distal region, the phalanges, fingers. The hand and wrist have a total of 27 bones arranged to roll, spin, and slide, allowing the hand to explore and control the environment and objects. Carpals. The carpus is formed from 8 small bones collectively referred to as the carpal bones. The carpal bones are bound in 2 groups of 4 bones: the pisiform, triquetrum, lunate and scaphoid on the upper end of the wrist, the hamate, capitate, trapezoid and trapezium on the lower side of the hand. Other bones of the hand are metacarpals, the 5 bones that comprise the middle part of the hand; phalanges, singular phalanx, the 14 narrow bones that make up the fingers of each hand. Each finger has 3 phalanges: the distal, middle, and proximal. The thumb has 2. Soft tissues. Our hand bones are held in place and supported by various soft tissues. These include articular cartilage, ligaments, muscles, and tendons. Articular cartilage is a smooth material that acts as a shock absorber and cushions the ends of bones at each of the 27 joints, allowing smooth movement of the hand. Muscles and ligaments function to control the movement of the hand. Ligaments are tough rope-like tissue that connect bones to other bones, holding them in place and providing stability to the joints. Each finger joint has 2 collateral ligaments on either side, which prevents the abnormal sideways bending of the joints. The volar plate is the strongest ligament in the hand. It joins the proximal and middle phalanx on the palm side of the joint and prevents backwards bending of the pip joint, hyperextension. Muscles. Muscles are fibrous tissues that help produce movement. Muscles work by contracting. There are 2 types of muscles in the hand: intrinsic and extrinsic muscles. Intrinsic muscles are small muscles that originate in the wrist and hand. They are responsible for fine motor movement of the fingers during activities such as writing or playing the piano. Extrinsic muscles originate in the forearm or elbow and control the movement of the wrist and hand. These muscles are responsible for gross hand movements. They position the wrist and hand while the fingers perform fine motor movements. Each finger has 6 muscles controlling its movement: 3 extrinsic and 3 intrinsic muscles. The index and little finger each have an extra extrinsic extensor. Tendons. Tendons are soft tissues that connect muscles to bones. When muscles contract, tendons pull the bones, causing the finger to move. The extrinsic muscles attach to finger bones through long tendons that extend from the forearm through the wrist. Tendons located on the palm side help in bending the fingers and are called flexor tendons, while tendons on top of the hand help in straightening the fingers and are called extensor tendons. Nerves of the hand carry electrical signals from the brain to the muscles in the forearm and hand, enabling movement. They also carry the senses of touch, pain, and temperature back from the hands to the brain. The 3 main nerves of the hand and wrist are the ulnar nerve, radial nerve, and median nerve. All 3 nerves originate at the shoulder and travel down the arm to the hand. Each of these nerves has sensory and motor components. Ulnar nerve. The ulnar nerve crosses the wrist through an area called Guyon's canal and branches to provide sensation to the little finger and half of the ring finger. Median nerve. The median nerve crosses the wrist through a tunnel called the carpal tunnel. The median nerve provides sensation to the palm, thumb, index finger, middle finger, and part of the ring finger. Radial nerve. The radial nerve runs down the thumb side of the forearm and provides sensation to the back of the hand from the thumb to the middle finger. Blood vessels. Blood vessels travel beside the nerves to supply blood to the hand. The main arteries are the ulnar and radial arteries, which supply blood to the front of the hand, fingers, and thumb. The ulnar artery travels next to the ulnar nerve through the Guyon's canal in the wrist. The radial artery is the largest artery of the hand, traveling across the front of the wrist, near the thumb. Pulse is measured at the radial artery. Other blood vessels travel across the back of the wrist to supply blood to the back of the hand, fingers, and thumb. Movements. Regarding the movements of the hand, the wrist joint has 2 degrees of freedom and supports the totality of any effort made by the hand. The fingers also have 2 degrees of freedom at their joint with the palm, also called the metacarpophalangeal joint, since it articulates the proximal phalanx with the metacarpal bone. 1 degree of freedom corresponds to abduction and adduction movements, lateral movements that allow opening the fingers. This movement is very limited. The other degree of freedom corresponds to the flexion movement, which is very large. The thumb has great mobility, which is key for grasping objects, and the other 4 fingers move in a limited way laterally, although their ability to flex to open and close the hand is very good. Grips. Our elongated thumb is able to oppose our fingers, and hence manipulate objects and instruments with a far greater degree of precision than primates and other animals. The function of the hand is to grip, grasp, and form precise movements, e.g., writing and sewing. This ability to flex the fingers is very important to the ability to catch objects and hold them securely. The gripping techniques were classified by Schlesinger into 6 different categories: cylindrical, toe, hook, palm, spherical, and side grip, as shown in the following image. Chapter